Oh, hi there, John Cummins for your weekly health check-in. Question is, what causes coronary artery disease? So don't forget that a blockage in an artery or a hemorrhage from an artery will kill, in our culture, about 40% of it. So it's a big number. So what I mean is heart attack, stroke, a gangrenous leg, for example, would be a blockage. So what causes these lesions ultimately is the setup of what we call atherosclerosis, that is cholesterol plaque getting into the wall of the artery. Now, we know from autopsy studies that in our culture, we start to form fatty streaks in childhood, and then it progresses through early adulthood, middle adulthood, late adulthood. And whilst it's far more common to have cholesterol build up in the arteries, a certain small percentage of us will actually manifest with symptoms. So we could have our whole life with a lot of cholesterol in our arteries, never have a symptom. But in some, it seems that they have a very inflamed area of deposition that can attract white blood cells, that can attract certain other types of cells, set up these hot spots of inflammation. And in a plaque that's vulnerable with a very thin core, it can rupture suddenly, and all of a sudden the body then dumps a whole lot of platelets or a clot on top of it to try and seal the lesion, but inadvertently blocks off an entire artery, causing a heart attack or a stroke. So, cholesterol is the end point, but in some people it's not necessarily the starting point. So I liken an artery to like a Teflon frying pan. We have a layer around all of our arteries, and if you laid them out, it's like 3 tennis courts of sheet-like material running through hundreds of thousands of kilometres of artery. And the Teflon layer, if you crack a Teflon in a frying pan, you scratch it, then that frying pan's gone. You're always going to get rust in there, aren't you? It's similar. So there's a number of reasons why you can actually tear the lining of your artery that then predisposes to cholesterol getting in there. One is getting older, another one would be being a male, another one would be genetic, so it's a family history of heart disease, another one would be high blood pressure, smoking, diabetes. I think you're all familiar pretty much with the risk factors for arterial disease. But what's really fascinating, if you look at the Global Interheart study where they looked at I think it was all of the continents and hundreds of countries, and the conclusion of the investigators, and I might make this a separate segment, is that 95% of blocked arteries are lifestyle related, because we just don't seem to see it in certain regions where the diet is much better. For example, smoking prevalence is low, physical activity is high. But also of that 95%, a whopping 15% is said to be biopsychosocial. What does that mean? That's stress. And in my experience, when we look for coronary artery disease by doing imaging of arteries, it is just really surprising that about one in 8 people, and the literature would support that, whom you think should not have any plaque because they don't have any of the traditional risk factors, have actually quite terrible disease, sometimes getting stented within, a few days of actually having the angiogram. So I'm becoming a much bigger fan of imaging arteries. I'll do a separate segment on this. And but I warn people that it's quite possible that you will have plaque there, and if so, then we have to deal with it. Because you don't want to be, even if you've got average, you don't want to be average. I don't believe. That's not why you're part of this practice. So one question I would ask is, have you had your arteries imaged? Now, not everyone. There's generally around males that are 50, females that are 60. I'd start to think about it. The guidelines would say a little bit later. But it's a pretty powerful test. So hopefully that's a little bit helpful, and look forward to seeing you soon.